This is Blue Left, a podcast dedicated to amplifying the underrepresented Democratic voices in Tennessee, working tirelessly to bring progressive change to the volunteer state. Here's your host, Peggy Kingsbury.
That's right. From grassroots organizers to community leaders, from urban centers to rural towns, we'll highlight the diverse perspectives and powerful voices that often go unheard. Join us as we lift up the blue wave and shine a light on the path toward a more inclusive and equitable Tennessee. I'm your host, Peggy Kingsbury, and this is Blue Lift, where every voice matters. Let's get started. Well, hello again. Thank you all for tuning back into Blue Lift. I really appreciate all the nice comments I've been getting in the various ways that you all send them. Some of you have even seen me in person and given nice comments, so we really appreciate that here at Blue Lift. And once again, I'm super pumped about my guest. As I've told y'all before, I only invite people I like. And we have Dr. Laura Andreson with us today. Dr. Andreson is an OBGYN here in the Williamson County area. She grew up in North Dakota, went to medical school at Des Moines University, did her residency at the University of Minnesota, and is board certified in obstetrics and gynecology. Most importantly, right now, Dr. Andreson is running for office here in Tennessee in the state legislature, and we're going to talk about that in a minute. Welcome to Blue Lift, Laura.
Thank you so much for having me. I really appreciate it.
I'm glad you're here. Cute story about Minnesota. So I lived in Minnesota for a few years, as I term it, a few winters. And I just absolutely love the people there. Just love them. And so in honor of Tim Walz and his candidacy for vice president, Paul and I had some friends over for dinner last week, and I fixed Minnesota hot dish.
Awesome.
Now, my recipe does not use canned soup. You make it yourself. So it's completely homemade. I dug it out of my recipe box from when I lived in Minnesota. And I have to say, it was pretty good. It's a bit tedious to put the tater tots on all in a straight lines, but it's also necessary.
It is, because they have to get crisp.
Yeah, to make it crisp and true Minnesota hot dish. Otherwise, it's just a mess, you know. So that was fun. I really did I really liked Minnesota. I sort of miss some of the winters. My problem was they just went on a little bit too long.
Yes.
You know, the first snows were just beautiful, and but then it's like, okay, it's March, it's April, or seriously, are we doing this in May? Mm-hmm. And yeah, I kind of got my feel. All right, well, we are going to dig in today and talk about some fun topics. Tell us, just to start out, just like you and I have never met before, because most of my listeners have not met you before, tell us what in the world turned you into a politician.
Well, I did not see this on my bingo card, that is for certain. However, when Roe fell, I felt I had no other choice than to get engaged in what was going on politically. All of a sudden, I couldn't treat my patients the way I'd been able to treat them for the prior 20 years. So I started engaging down at the Capitol. I would speak out at press conferences with advocacy groups, started going to their offices, committee meetings, and over time realized that no amount of expert opinion, education, reasoning was really making any kind of resonating noise in their heads. And then I got involved with a lawsuit against them with the Center for Reproductive Rights against the state of Tennessee, because the laws right now are too vague and they are unconstitutional because women do not have the same rights to standard of health care as men do, pregnant women. And that lawsuit is still pending. We had the hearing on April 4th, but we still do not have a decision. After the session this year, they armed our teachers and they passed a trafficking bill that makes it so that children that are 12 and under cannot be taken across the state line for an abortion unless it is by a parent or a legal guardian. And the tragedy in that is that these children are typically victims of incest and rape, and oftentimes the parental figure is the person that has done this to them. So it's just, all these laws are passing, nothing's changing. Try to talk to them, reason with them, try to take legal action against them. So the only remaining answer was to run against them and take their seat at the table.
I mean, that's so powerful, all the things that you've just said. And I think that what I want to do is make sure that our listeners understand when you say that women don't have the same rights to health care, pregnant women, as men do. Let's talk about that, and let's talk about that in terms that someone who knows very very little about reproductive health care can really understand. You mentioned that when Roe fell, it changed everything about how you do your work as a physician. Expand on that just a little bit.
So an abortion, by definition, is removing the fetus, embryo, placenta from the uterus. And that is sometimes needing to happen when there's a pregnancy that is outside of the uterus, a pregnancy that could turn into cancer called a molar pregnancy, a situation where the mother is either bleeding or her water is broken well before that baby could survive outside the uterus, situations where the baby can't survive because it has so many anomalies that aren't compatible with life, and situations where maternal health is in danger. So I think that a lot of the times when we say the word abortion, and I don't like this term, but those on the anti-choice side of things see it as abortion on demand, or that women are being lazy and using this as contraception. And that is actually the most rare of events that it's being used routinely for contraception. And it is most often being used in the situations I just described. So suddenly my hands were tied. If a woman comes into my emergency room hemorrhaging at 16 weeks, she is literally bleeding to death in front of me. And I have to question whether or not I will be charged with a Class C felony and spend time in prison for saving her life. And that was a really raw place to be. It felt like every time you go to work, you kind of have this hanging over your head that today could be the day that everything changes for me and my family. And so women don't have the right to be able to be treated for these conditions in the state of Tennessee right now. All we can treat is women who have an ectopic pregnancy, women who have a molar pregnancy, treat miscarriages, and we can treat for the health of the mother, but it has to be very clear that we are using reasonable medical judgment, which can be looked at in hindsight and questioned, versus good faith medical judgment, which means I can practice in real time and make decisions in real time. Before I got into advocacy, if you would have said to me reasonable medical judgment and good medical judgment, or good faith medical judgment, I would have said, aren't they the same thing?
But they're not. Explain that.
They're not. So reasonable medical judgment means that, so let's say, and I've heard the lobbyists say this, someone comes in with their water broken at, I'll say 19 weeks, because viability is typically recognized as 24. Some institutions will go down to 22 weeks. So water breaks at 19 weeks. And that circumstance, the baby's lungs stop maturing. The amniotic fluid volume goes down because babies swallow the amniotic fluid. It helps their lungs to develop, and it helps them to create they urinate it out, and it creates that amniotic fluid in the womb. When that happens, the woman is automatically at a serious risk for infection and or bleeding, because sometimes that placenta can separate from the uterus and significant blood loss can occur after that. So they could say, so let's say I make the decision, we do the abortion, and someone comes back a year later, 2 years later, and says, I think that might have sealed off on its own, and probably that baby would have been able to survive. So we're going to bring criminal charges forward against you. And I'm assuming they would be able to find a legal expert that would back that up. And it would result in, if I was charged, not even the criminal charge, if I lost or won with the jury, immediately I have a felony on my license, so my license would be lost.
And all the money for attorneys.
Yes.
Your insurance, your liability insurance shoots way up or is canceled and you can't find any.
Right. So all those things would be gone. My career would be gone. And that's a hard reality to look at too. Maybe you win the case, but there again, you have to get reinstated with your board certification, your licensure, your privileges at your hospital.
Right.
I mean, at what point would you say, you know what, I'm not doing this anymore?
So what's the difference then in reasonable and what was the other phrase?
So good faith medical judgment. That means that so the woman's water is broken, I do the abortion, that will stand on its own because I was making those decisions in good faith with the best information that I had at that time, and it can't be second guessed because they can't sue me for my intentions.
So, but the new law in Tennessee does not include that. It says reasonable, which the law was written by unreasonable people, so I'm not real sure what their standard for the word reasonable is. But thank you for that explanation because I know there's a lot of us who didn't really understand that. And that's just very disturbing to me. And especially since the way I see it, and you spent a lot of time at the State House, so I'm sure you can opine on this. The current law was written by non-physicians and lobbyists. Well, the lobbyists obviously have a goal in mind. They are paid to get those kind of laws passed, and then the non-physicians are politicians who have never, I don't know who the sponsors of the bill were, but I'm guessing it was a couple of dudes. They've never been pregnant, And I know there is some footage of one of the dudes in the Tennessee legislature saying that he felt like he just knew that miscarriages only happen in the first pregnancy.
Yeah.
That's how ridiculous that, it's really shocking. But that explanation really is good. And I was going to ask you about a real life situation, obviously without using names, but you've kind of described what can happen and what is, I think most women would say that's just health care. I read, and I don't know if you know of a situation like this, but I read the other day about a woman who was in another state. She had a brain cancer and, she got pregnant. And with the chemotherapy and the pregnancy and all that, the determination was made that in order to prolong her life and give her any chance at all of survival and raising her other children, she did not need to be pregnant because I'm assuming chemo and radiation would be a very bad thing for developing fetus.
Yes.
But they refused that.
Yes.
And that was just basically a death sentence for her, and took time away that she could have had with her other children.
And we've had patients like that in Tennessee. Most of these stories that you're hearing from other states have happened here as well.
Right.
Tennessee and Idaho have the most strict bans in the United States. So and they like to copy each other. So Idaho passed the trafficking bill before we did, and they just want to mirror and create this altered universe where they control women.
Wow. And I don't know if you know this about me, but I have a criminal justice background, and whenever I hear about a minor being pregnant, in my mind, that just means that an assault has occurred. It's not. It's nothing but that. So we're talking about a victim now, and we're also saying, or the legislature is saying what that victim can have in terms of support. So I always look at teen pregnancies or, a pregnant 13-year-old. To me, that's a victim of a crime.
I agree with you 100%. And I've cared for those children in my career. And, there's a lot of these situations. I wish I could bring that legislator to the situation with me and see what really goes on. Watch the emotions. Think about what you're really doing to this person.
But let me ask you this. It's one of the things that we hear a lot is people say, well, the situations that you're talking about are really, they don't happen that often. And more often what we have is, these 20 and 25-year-old women lining up at Planned Parenthood to get an abortion because they got pregnant and they don't want to harm their career. How do you respond to that when people say that?
It's just not accurate. Most women that present to abortion clinics are already mothers, and they know that having another child would destroy their family financially, emotionally. Maybe they're being abused, and they know that in pregnancy they're more likely to be abused or killed. So that is a rare exception that abortion is being used for contraception, unless you're using the definition that our state uses, where it's when the egg and the sperm meet, and that is the definition of life. But I think because some IUDs would prevent implantation, and that's contraception, but not abortion. But I think people need to realize that when someone presents to a clinic or to a physician with a pregnancy that wasn't intended and could alter their trajectory of their life, they don't know the circumstances of their relationship. Again, domestic abuse. They don't know what's going on in their family. Maybe they have medical conditions that they couldn't survive pregnancy, like cancer or heart disease, diabetes.
Right. They just don't know.
Right.
Yeah. And I don't want us to talk the whole time about this one issue because I know your candidacy involves a lot of other issues, but I also hope that my listeners can appreciate the fact that you are not an extrovert.
I am not.
You are not an extrovert. You are a very quiet, demure. I know that's been used all over TikTok, but I'm going to use it right now, so my younger listeners are going to love that. They're going to snap when they hear Miss Peggy say demure. But you are just the epitome of a very smart, thoughtful woman, and doing this candidacy, running for office is really outside of what you could have imagined for yourself. But what that says to us, I believe, is that there comes a time when something is so important and so meaningful that you just absolutely have to step out and do it. Now, what do your medical peers think of this?
It varies a little bit. Interestingly, a lot of people don't think it'll happen to them. It's almost like when people say, well, these complications of pregnancy are rare or they don't really happen that often. Actually, they do.
Yeah.
And I think a lot of physicians live in this world where they think, well, I'm not working in an abortion clinic, so nothing's going to happen to me. I'm fine. So I feel like there's been more apathy than I anticipated. There's also a lot of fear of maybe losing trust from your patients because maybe they are anti-choice. I've experienced that a little bit, even just recently, being asked to really step away from where I work. And I've been careful to not, their opinions are not mine. Mine are my own. And I've been very careful, but I made a small error and was really asked pretty sternly that not happen again. But the error you made wasn't medical. It was something in the practice. I had a logo on a jacket when I did an Instagram post.
Oh, there you go.
And so that hurt though a little bit.
Sure.
I work in an OB clinic. It's not like I'm working in, I don't know,
orthopedics.
Yes. Yeah. This affects you also.
Right.
And I respect also that they don't have to support me and that they can have their own views, but this affects your profession. This affects your patients.
Well, sure it does.
So
it does.
I think sticking your hand in the sand isn't always the best
answer.
Yeah,
no. And I'm sure that, if they're faced with the situations that we've just discussed, they would do the thing that medically needs to be done. But I think there is a naivete that says, well, nobody's going to come after me. Well, we just don't know that for sure, do we?
No. Why would you make laws if you're not going to utilize them?
Well, that's right. That's exactly right. Plus, I think, too, that, we have to also, I would hope that your peers would think a little bit less about themselves and more about the patient because, these sorts of things are all in the news. Patients are afraid to go in for things like that, and we don't know how many women are suffering at home with things that then they think, oh, I'm bleeding. Well, I can't go I can't go in. They won't do anything for me. And that can be a very serious situation.
Yes.
There's a lot of fear. I just as a side note, you talked about, you mentioned IUD. And just for those listeners who don't know what that is, just give us a brief description of what an IUD is.
So an IUD is a T-shaped device that can be placed in the uterine cavity to prevent pregnancy. The main mechanism of action is thickening the cervical mucus so that sperm cannot penetrate it. So there is no fertilization that's occurring in most cases. If it does occur, then the Paragard IUD is made of copper that can make the uterus basically uninhabitable. And the Mirena IUD has progesterone and it thins the lining so much that an embryo could not or should not implant. Now, they occasionally do. We see ectopics with IUDs in place and sometimes pregnancies. But I think we call it long-acting reversible contraception. They're very effective. In fact, they're in some cases more effective than even tying your tubes. So this is a good way for women to protect themselves from pregnancy and just do the right thing. They don't want them to be using abortions for contraception, so let's keep this legal and protected.
But they could come after that because there is a chance that it has an effect on, what's the right phrase, when the sperm and the egg have gotten together? What do we call that?
Fertilization.
Yeah.
And could affect the implantation of the embryo.
And some believe that that's when life begins.
Yes.
Okay. So when I was on the way here today, I was listening to a podcast called Stuff You Should Know. I don't know if you've ever heard of that.
I haven't listened to it, but I have heard of it.
It's really good. And they have an episode on about the history of Lysol. Do you know that Lysol was once used as birth control? Actually, for quite a long time. Yes. So Lysol was invented, and it was, to get rid of germs originally. And there's horrible chemicals that were in it. Don't sue me, Lysol. Just the podcast told me this. I'm repeating what I heard. But we all know that there are things, in Lysol that kill a whole lot of germs. That's why during COVID, we were basically bathing in it. Some may have tried to drink it, but that's a whole nother topic. But so Lysol, when back in the late 1800s, patients were getting burned by it in hospitals. They were using it like betadine and, just putting it all over people. And so finally, the laws came out and said, well, you can't use it for that anymore. So they had to sort of remarket themselves, and they could not specifically say use it as a birth control, but the way they marketed it was for, feminine hygiene, and it was used, and listeners, I apologize for using this word that people have problems with, but it was used as a douche.
Oof.
Yes. And so all the women knew that's what they were using it for, was to stop a pregnancy. And that went on until the 1920s.
Oh, my goodness.
Yes. And of course, as the podcast pointed out, some, even though they quit marketing it with those veiled words like that, some women were still using that because, of course, birth control was not legal until 1972 and only for married women. Now, when I'm talking to younger people and they all, I might say something about my age, they're like, oh, Miss Peggy, you're not old. And I think, in my lifetime, honey, birth control wasn't legal till I was 13, 14 years old, and I don't, and you had to be married at that time to get it. But yeah, Lysol was used. So it's, when I heard that, I thought, wow, it is so interesting how women's bodies have not been seen as anything to protect and to take care of for so very long that it seemed okay for a company to market a product that was caustic to be used as birth control because it's just women, Yeah. And it's really, really very sad. So on your campaign website, you mentioned a lot of other things that you're interested in, other topics. I saw one area that I thought was really interesting, and you speak about economic well-being. And I find that so interesting. The way that you describe the topic is that it's not just so that the people in Tennessee can have more comfortable lives, which is part of it, but if we're not a state that promotes economic well-being and that has economic well-being for all classes of people. We can't get and retain really good talent here. Talk about that a little bit.
I truly believe that when we help each other to be better, we're all better because of it. So if we make housing more affordable, we get rid of the grocery tax, we expand Medicaid, we bring people up. Instead of saying, well, you made some bad decisions, or it's not my fault you're in poverty. And none of those things are working. These people are just suffering, and we need to bring them to a place where they have affordable health care, where they have housing they can live in that's safe and not either infested or has poor building materials in it, things that can be caustic to people. And once we can find ways to make that happen, and there are ways to do these things, Medicaid expansion could be done quite easily without causing a whole lot of financial burden on our state. We will then see the benefits of people educating themselves, getting better jobs, learning their trades and becoming experts in them. And we'll see our state flourish. But as we keep forgetting about people, forgetting about the rural areas, it's just heartbreaking what we're doing to them.
It is. And I've heard some politicians say, well, what you're saying isn't so. We're still going to keep attracting great talent. We've been doing that for years. Tennessee's booming. Nashville is booming. However, every source will tell us there is a slowdown recently. And I believe some of that slowdown has to do with the fact that some companies and the employees of some companies are saying, no, I don't think Tennessee's for me right now. It's not for me and my family. I have daughters. I have LGBTQ plus people in my family whom I love, or I am that myself. And, I'm a scientist. Some of the Tennessee laws are indicating you folks don't believe in science. And so, I do think we're seeing a bit of a slowdown. And if this sort of wild legislation continues, I think it will get worse.
I agree with you.
People won't want to come here. Now, from a physician's standpoint, particularly OBGYN, you've seen that slow down some, haven't you?
Yes, there was a 20% decrease in OBGYN residency applications this past year. And it wasn't just OBGYN, it was across the board, all residency spots. So what that means for OB alone was that there were 380 fewer applicants. That means that we are attracting less talented people to come here and do residency. We're attracting fewer people to come here and stay because about 50% of people stay where they trained.
Oh, wow. Okay.
So we're losing out on lots of talented people. And the other thing is that a lot of physicians are choosing just to not come to banned states because they can't get the healthcare they need. A lot of women, by the time they are done with their training in medicine, are in their 30s. So that's automatically a higher risk pregnancy.
Right.
So why go to a state where you can't get healthcare? And then even with the OBs training here, now they have to go out of state to train to be able to do abortions. And that takes money. If they have families, time away from their families. It's just a lot of logistical nightmares.
So why would an OBGYN who wants to have a full practice even bother to come here? And of course, the ladies who are listening know that it's not easy to get an appointment with an OBGYN in Tennessee as it stands now.
Yes.
It's sort of like, every time I see mine, I'm like, oh man, I hope she's not going to retire. What's going to happen to me, so that's a serious concern, and that does speak to our entire economic well-being. And you mentioned rural areas. The hospital closures in these rural areas, I think for heart patients, for pregnant women, that's just very scary, isn't it?
It is.
It can be miles, and in some rural areas, there are not even physicians, OBGYNs, that a pregnant woman can see for her prenatal care.
Yes, people are traveling 2 to 3 hours for prenatal care. And then you think about the poverty that's there. And do you have more than one vehicle? Do you have children that need childcare?
Right.
I mean, so many obstacles when you have to travel that far. I mean,
do you have a job that will give you the time off to go for that? You know, if you're an hourly employee, probably not, without missing pay, which might mean the groceries are short that month because grocery tax.
yes.
You know, it's all a big cycle, and when I look at these issues, I guess I always look outside of myself because I think, well, those things don't affect me. Obviously, I'm not going to get pregnant, and I can afford my groceries, but it's what it does to other people, And one of my friends from another state told me that her daughter's family was thinking of moving to Tennessee, and she was really worried about it. And I said, well, it's okay. She said, well, yeah, but you don't understand. She's already had one baby and had lots of issues with her pregnancy, and she wants to try again. And I'm afraid she'll get down there and something will happen and she can't get the care she needs. And they've had in her family, a lot of the females have had very problematic pregnancies and hemorrhages and all sorts of things. And so I never really looked at it that way. And I thought, oh my goodness, she's worried about her female child living here.
And that I hear that a lot in my office. It was worse, as time goes by, people kind of forget. But in the beginning, there were so many patients that said, I'm really scared to even start a family here. Are you going to let me die? Things that you never want to hear. And my gut instinct is, of course, I'm not going to let you die.
Right.
But there were a lot of barriers, and there still are a lot of barriers. I still don't think I would let anyone die. Actually, I'm 100% certain I wouldn't. But there is also the flip side when I start to think about what I would sacrifice in that circumstance if I were charged. I mean, I would lose my family, my career.
Yeah, and it shouldn't be that you have to have that worry. I don't have that worry in my job. You shouldn't have that in yours. And, as a very highly trained specialist, you should be listened to, and that's what happens in our legislature. They don't listen to the experts. They decide what's politically cute, I guess. And the experts are there. They're always there to testify, but we've heard so many stories, even coming through these chairs in Blue Lift, where they don't call on the experts or they don't listen to them, or when the experts sitting there testifying, there's chatter going about. They're not listening, and that just is very sad.
That was really eye-opening to me. I had no idea that they treated the general public like that.
When you go, it's really, I urge everybody to go just to see it for yourself.
Yeah, and if you can't go, log on to the website and watch them, because you can literally feel them rolling their eyes at people. It is. You can. It is just awful.
Mm-hmm. The minute the person starts to speak, if it's not someone who agrees with them, they'll turn their chair, they'll look at their phone. No respect at all. None. It's kind of bad sometimes at the U.S. House of Representatives, but it's nothing like what happens in Tennessee. At least in the U.S. House, they kind of listen. Mm-hmm. Not here. They just completely ignore. Another topic that I know is important to you is safety, school safety, gun safety. Talk to us a little bit about your stance on that.
So as you said, I'm from North Dakota, so I grew up in rural on a farm. There were guns in my house. There were guns in our vehicles. It was just a way of life. I didn't really think much about it, but we didn't have the epidemic of gun violence that we have now in the 80s. So I always thought that guns should be controlled. I don't think we need to take guns away from people. I think it's okay to have ownership of guns, but I think there should be safety mechanisms in place. We should be able to have background checks. We should be able to, if someone's having a mental health crisis, remove the guns from their home so they don't hurt themselves or someone else. We should be able to make logical decisions in our legislative bodies to protect the general public. I've said many times, my son was in kindergarten when Sandy Hook occurred, and it broke my heart that they did nothing after those babies got murdered. Oh. And every day that he's gone to school, I've always, and my other son too, just like, are you going to come home to me? Because I don't know if you are. And all the phone calls you get from the school, we're in lockdown, and just thinking about those children hiding under their desks and being terrified. And then Covenant happened, and I just think it hit home here and made people realize this can happen anywhere. And it has been happening all over. I don't feel like anyone's immune to it.
No.
But we need to bring common sense into this. We've gone backwards. Like, we have permitless carry. We want to arm our teachers. More guns do not equal more safety. The guns in cars issue, all these guns being stolen out of cars and used in crimes and used to kill people, suicides, it could be stopped. And that's the sad part about all of this gun stuff is we as adults want to protect our children, our families.
Right.
And our legislators are shutting us down, both at a state level and at a national level. Most people want gun safety.
They do. And you said that, you talked about the legislation, that it expanded it. Who would have thought 5 years ago that what we really apparently should have been saying to the legislature is just don't do anything. Just don't do anything, But instead, people were asking for a little bit more strict legislation. And so they just did more. We would have been better off if they'd have left it alone at this point,
Yes.
And I always say, follow the money. My listeners know that, and we know that's what that's all about. It's the money of the gun lobby and the manufacturers, et cetera, and the Tennessee Farms Association. But there are so many logical things, easy things that we could do. And I am a gun owner, and I am totally in favor of a waiting period, for example. A lot of suicides are committed by young men who go and get a gun and do harm to themselves right away. A waiting period, a cooling off period, which kind of leads us into mental health care. Talk to us about your thoughts on what we can do around that issue in Tennessee.
We need to create programs and develop training for people to be able to help people with mental health crisis. It is not easy to get a mental health care provider. If you today were having suicidal thoughts and wanted to try to get into a psychiatrist, psychologist, even a therapist, you most likely couldn't do it unless you knew someone personally that could get you in there. I've had patients in medical crisis, and I've called multiple places. You end up having to hospitalize them, and there's just not a good system here, and it's expensive. Insurance doesn't cover mental health care. So to go see a therapist is around $200 an hour. People don't have that kind of money. They can't even buy groceries. So you get someone that has limited financial means, they're in mental crisis, and you just say, well, it's about mental health. It's not about the guns. And that's just a cop-out. I feel like we need to address both issues.
Right.
But making safety mechanisms for gun ownership is far easier and time efficient than what we need to develop a better mental health care system.
I agree, although we need to do both.
Yes, we do, 100%.
Yeah.
And I think, again, expand Medicaid, get more dollars out there so that we can feed that into our healthcare system. We've paid that money into our federal government.
Yes, we have. Yes, we have. And for the listeners who may be asking about what that is, I would urge you to go back and listen to the episode I did with Claire Jones, where we talked specifically about expanding Medicaid and the specific amount of income that you have when you're then kicked out of Medicaid in Tennessee. So you're technically, according to the state of Tennessee, not poor enough to need help with your medical bills. But still, by any standard anywhere for any human being in the United States of America, the amount of money is like you're still really very poor, and Absolutely. You need help. And so, and we all know that what happens then is when people don't have health care, whether it's prenatal health care or just general health care, and things get really, really bad, then they do show up somewhere at an emergency room and they are cared for, thank goodness. But they're sicker than they should have been. And so it's costing all of us a lot more money if you want to think just about the dollars at that point. And we've let a human get a lot sicker than was necessary when we have ways to have treated them had they had an opportunity for that sooner. So, I mean, it's just a big issue. Well, let's pretend that, and it's not a stretch, but let's say you've been elected. What's one of the first bills you might like to sponsor?
I would like to work with the Tennessee Medical Association, the big medical institutions in the state, University of Tennessee, Vanderbilt, to create a abortion law that allows exceptions for fatal fetal anomalies, maternal health, rape, and incest, so that we can take care of the women of Tennessee right here where we are and not have to worry about being charged criminally.
So we at least can say to women through a law, if you have a pregnancy that's going to result in very serious harm to you, death, serious harm, the inability to have more children, long-term health issues, we can give you health care for that. And if you are a victim of a crime that results in a pregnancy, we'll give you help for that as well.
Yes.
I mean, that just sounds so logical, doesn't it?
It does.
And I know that this little quip has gone around quite a bit, but there really aren't any laws that tell a man what he can and can't do with his body.
There are not.
Or that say to a man, well, you've got to die or be on death's bed before we're going to help you. I just can't imagine that would never happen, actually. But so that's one of the first things you would do. How about around gun safety? What sort of law would you like to sponsor?
I would like to sponsor a law to create basically that cooling off period you were talking about. Let's have a waiting period, and also the ability that if your neighbor calls and says, my neighbor was just over here, he's talking about killing himself, they come and can take your guns away for you for a period of time. This doesn't mean permanent removal, but just keep us all safer.
Yeah, just for a few days so that you can go before a judge and the person can say, man, it was a bad episode. I'm sorry. I won't do it again. I want my guns back. Or that the person needs some ongoing mental health care, which sadly, as you said, in Tennessee, I mean, I have friends whose teens have been in real horrible episodes and they really, really needed intensive care for mental health issues and they couldn't get it. They just couldn't get it. And that's very, very sad. We shouldn't be in that position. Well, I am so glad to have had you here today, and I know that you are right now in the biggest push of your candidacy. Tell everyone what they can do to help you get elected.
Vote.
That's a big one, isn't it? Yeah.
The other things are if you can come out to canvass with me. Williamson County Democratic Party is doing a great job of organizing volunteers. My social media and my websites both have information on how you could volunteer. And we also need funds to do all this stuff, which is also always a hard ask. But even if you can donate any amount, it all adds up and all helps because money does win elections. To run a good House election in Tennessee, you need about $100,000.
That's right. So your website is?
www.laura4tn63.com.
Okay, and that's LAURA.
Yes.
4tn63.com. So I want to urge you listeners who are in the area, or even if you're not in the area, just check out that website, hit that donate button, give your Starbucks money to Laura today. And also, if you are in the area, hit that volunteer button. And, canvassing, as I've told some of you all before, is actually fun. You're not going to go to houses where people are already way against the candidate that you're voting for or representing. That's not how that little algorithm is set up. You don't go into a neighborhood and just knock on every door. You're knocking on selected doors and really asking people, hey, do you know about Laura? If you don't, let me tell you. And also, please remember to get out and vote. We are a state that does not vote. 18% voter turnout in the last election, which is just still shocking to me.
Me too.
In a room of 10 people trying to make a decision of what kind of pizza we're going to get, 2 people make the decision. Now, how's that going to fly? almost none of us want to depend on two people to make our pizza decision, right?
That's a great analogy.
Why are we depending on two people to decide who's going to run the show politically and then it affects our families and everything. So just make your own pizza decision and vote. You get to choose. Well, thank you so much for being here, Laura. And our listeners, thank you for listening. I want to remind you to like, share, and comment on the podcast and let me know what you're thinking. If you have other questions for Laura, again, on that website, she will be more than happy to respond to you. And also, you can come by the WCDP headquarters in downtown Franklin and get a sign for Dr. Andreson to put out in your yard, which is a cool way to show that you care and that you're a smart person who believes in science.
Yes.
All right. Thanks for being here, Laura. We'll see y'all next time.